Although cervical cancer is the leading cancer diagnosed amongst women in our country, breast cancer has also consistently been among the top 2 to 3 cancers that are common in women's lives in Uganda. It is said that 21 out of 100,000 women have breast cancer, but 10 out of 100,000 women in Uganda also die from breast cancer, meaning that half of the people diagnosed always end up dying, and that is very tragic. But also it's because of late diagnosis, among other things. It is the Breast Cancer Awareness Month, and that's why we are here to talk about this today. Thank you so much for joining us. I am Viola Sasia. Beginning, what made you feel like something was changing about your life? What did you observe? And what was that moment where you made the decision to go and seek medical attention?
To be honest with you, I wasn't paying much attention to the signs and symptoms. I could just occasionally fall sick and go to the hospital, check you, they tell you it's malaria. Not until I developed a mass, a lump in my left breast. At first it was one. I took it for granted. I didn't even bother, it never even crossed my mind that it was cancer. Not until the pain worsened, I developed another mass. They became 3. So when the pain persisted, that's when I was like, let me go and do a scan. When I did the scan, they told me I have lumps. I should go and do a biopsy. And I didn't do it there and then. I kept my results for some good months. So when the pain persisted, that's when I decided to go to Mulago. I did a test, a biopsy. Yeah. When I did a biopsy, they give you 10 working days to get your results. So when I did that, after the 10 days, they called me back to go and pick my results at the Cancer Institute.
All right, so Harriet, what went through your mind the moment you were told that you had breast cancer?
I could not believe it. And to be honest, even the doctor who gave me my results was shocked because I started laughing about it. I was in shock. I could not believe it. I was like, maybe they've given me results that are not mine. I even told her, you know what, can you check me again? And she was like, no, those are the results. The other results, the tests we did, they came out negative, but this one, it's cancer. So later on, she left me in the room. She told me, you can cry it out, you can call whoever you want to call. I just told her, I just want to go home. I just want to go home. But then after that, I had to call my mom. I told her, Mom, they told me it's cancer. That's when I broke out. That's when I broke out. I called my brother. My brother came, but still I was in denial. I could not believe it's cancer. So the moment I accepted it and took it seriously, it was when they opened up for me a file and they gave me a card to start chemo.
Also, what was the reaction of your close friends and family?
My mom was scared. I remember that day I told her, she even collapsed because she has pressure. Yes. And she was like, no, you're going to die. Because even me, I was like, cancer, I'm going to die. Yeah, that's what came into my mind. I was like, no, it's death.
You spoke of chemotherapy. What other kind of treatment did you undergo, and how were you able to cope with the side effects from all that?
Chemo is hell on earth. That's what I can talk about it. It's treatment given to cancer patients, and I wasn't taken through the procedure, what the side effects were going to be, what the challenges that are going to come. So I just started my treatment without any counseling, without any knowledge. The only knowledge I had about cancer, the chemo, the treatment, was in the movies that I see. Maybe it's just the movies. So I'm not going to lose my hair, I'm not going to change my color, those side effects are not going to come to me, but reality came and it happened. Yeah, I got the side effects of, first and foremost, you get traumatized because you have your hair, you just see hair falling off. That's after when you start the chemo.
I understand this journey hasn't been very easy, so let's talk about the moments where you felt like this is too much, I'm almost giving up. Did that ever occur to you? But also if it did, how were you able to push yourself through?
The truth is, I reached a time and I felt like enough is enough. Because as I told you, chemo suppresses everything, every cells in your body. So you feel like your whole body is aching, you're tired of everything, you're putting people on pressure. Even you yourself, you're like, why don't I just die? Why don't I just die? But what kept me going was my boy and my family. Yes, and friends that were with me, prayed for me, supported me, telling me you will make it. But I reached a time, I remember on my fourth round, I was always on and off in the hospital because my body became so weak. I could not eat. I lost my appetite. I reached a time whereby like my blood cells were so low because of the chemo. They were so low. So it could be hard for me to get treatment because every time you go for chemo, they need to do a CBC. So if the CBC results are not good, you're not given the chemo. You have to eat, you have to drink, whereby you don't have the appetite because of the chemotherapy. Yes.
So how did you handle fear of a recurrence or uncertainty about the future? When those moments popped up, what did you tell yourself?
Yes, of course, as a human being, you think maybe it will come back with time. But if you're persistent with your medicine and if you follow what the doctors tell you, because you know, people will come out and tell you, use herbal. All this heals this. Cancer is not real, you'll be bewitched. So if you follow the doctor's ideas and you follow what they tell you to do, you get better. You get fine. Though the journey is not easy because when you're done with the chemo, you have to operate you. As in that's the cutting off. They had to cut off my breast so that because the chemo suppressed the masses and they were in one place. So to avoid the cells to circulate around the body again, they have to cut the part that has the cancer. So they had to cut off my breast. After cutting it off, I had to do radiotherapy. Radiotherapy is a process whereby they put you in a machine to dry the wound. In case if the cancer cells, in case if they were operating, maybe the cells tried to run somewhere, the radiotherapy helps to dry them out. Yeah.
So Harriet, in your opinion, what are the biggest challenges that you went through, as well as what did you observe from the other patients that were surrounding you? And how can that be made better?
The challenges that we experience at the Cancer Institute, we need more teachings. People come without knowing what to expect, what they're going to go through, what are the procedures, what you're not supposed to eat, how are you supposed to take yourself, those kind of things. And maybe the care, if maybe they're gentle with the patients, it will really, really make much difference. Yeah.
To wrap up our interview today, what is the message you have for women that might be out there fearing to go for screening or delaying to go for screening, but also what is a message of hope that you can give out to people on this journey?
The message I would give for people who have started the journey, I would tell them it's not easy, but it's not the end of the world. If you really tell yourself that, I used to tell myself, I don't have cancer, I have malaria. What you speak upon yourself, it's what God does for you. So you should not give up on yourself. You should follow what the doctors tell you to do. Don't mix the medicine with the herbal. Please, I beg of you, don't be scared. Because if I went early, I think I would not have lost my breast. If I paid attention to the signs and symptoms. If I really went to the hospital, I would not have reached where I reached, to almost losing my life. So to my fellow women out there, please, please don't be scared. Cancer is not the end of the world. It's not a death sentence. You can't see me here. I was a breast cancer, stage 3, not stage 1, but stage 3. But I managed to kick it out. So what if you go and find it early? Meaning you will not even lose your breast, you will make it out. So as a cancer survivor, I would really encourage my fellow women out there to please and please kindly go for breast checkups. It could not be only breast checkup, cervical checkup, any kind of cancer checkups, please. You know, as we Africans, we wait for something to get worse. So please don't be like me. Don't wait. Go out there. If you hear any hospital announcing we are doing cancer-free checkouts, please don't fear to go there, because the earlier, the better.
So Harriet, to begin this interview, take us to the very beginning. Once again, a very good morning to you and welcome. I am Viola Sasira. This is NTV Medical Matters. We are supported by Bill and Melinda Gates Foundation. But what makes today urgent? Like you heard from Harriet narrating her story, her journey with breast cancer, 89% of women, according to estimates, report to the hospital very late at stage 3 and 4, which is very hard to cure in comparison to those who go early. And so that is why it's very important that we get to understand what this is all about. But behind the figures are real lives of women, mothers, sisters, aunties who are really struggling to access early diagnosis as well as treatment. So here to discuss breast cancer is Dr. Victoria Nkore, General Surgeon, UMC Victoria Hospital. Thank you so much for coming.
Thank you for having me.
Yeah, so let's begin. We shall begin with what exactly do you do at UMC Victoria, and what role have you been playing in these women's lives, as well as being a breast cancer awareness month? What key message do you have for our viewers?
Good morning. Thank you for having me here today. My name is Victoria Nkore. I am a general surgeon at UMC Victoria Hospital. Yes, so I have been practicing as a surgeon for about 2 years now. But yes, during residency also for about 3 years. So we've been meeting different patients for all that time. And multiple breast cancer patients. And October is Breast Cancer Awareness Month. So if you've noticed, most of the hospitals, most of the companies are really talking about it because it affects us, really, affects our loved ones and affects many people. Yes, unfortunately, it kills, it is a leading cause of death in African Americans and Africans. It is the second, it is the highest cause of cancer in women in the world. But in the Western world, it is lung cancer that kills them. But for Africa and African Americans, breast cancer is the leading cause of death. Yes, in cancer patients. So it is a very important topic and a very important part of our lives, yes, as African women and as Africans. So yeah, thank you for talking about it.
You're welcome, and thank you for coming to talk about it. So let's start with the real meaning of breast cancer, what is happening, what exactly is it made up of?
So cancer as cancer is development or abnormal development of tissue in the body. So our body is made up of cells, micro cells. So let me give an example of the skin. So we are always shedding skin and bringing new skin. So it forms at a normal rate.
Okay.
Unfortunately, sometimes it forms at a very rapid rate that is beyond normal. So cancer usually forms or develops when the cells in our body develop at a more rapid rate than is normal. And that can happen anywhere in the body. So it can be the skin, it can be the eyes, the brain, so anywhere in the body. So it can be a natural process, or there are some factors that cause the abnormal, we call it abnormal replication of cells. So the abnormal growth of cells, yes. So that is what cancer is. And for breast cancer, so we are just having abnormal multiplication of cells within the breast tissue. Yes, so that's what breast cancer is in
simple terms for us.
In simple terms.
Okay,
yes.
So why is it so dangerous for the cells to multiply very fast?
So you know how the saying goes, anything
Too much of
Too much of anything is always bad, yes.
Okay.
So that is what happens in this case. So too much of anything is bad. So when these cells multiply, remember they are growing bigger and bigger. So if they've been multiplying at about 10 times a day, now they're multiplying at 1 million times a day. So these cells, they take up blood in order to grow. And because they are over multiplying, you end up getting cells that are not even normal. So they now come from normal to being abnormal cells that the body doesn't even recognize. So because of that, now the body is trying to fight to take away this cancer, but it is growing at a higher rate. And because it is growing at a higher rate, it is now eating all the nutrients in the body, eating all the blood in the body. So it ends up becoming a problem that normally you'd survive with your small breast, but now it is becoming bigger and bigger.
I get you.
And because it is multiplying at a rapid rate, and the cells are abnormal, so they end up dislodging, and then they also affect the other parts of the body. Yes, and then it also gets into the bloodstream, and it goes to the rest of the body. So that is when you now get the bad effects, the detrimental effects of cancer. Yes.
Thanks for the detailed explanation. So what causes it, and who is more at risk in the population? So
there are multiple factors that put you at risk for breast cancer. However, I think from the numbers are right, about 90% of the cases of breast cancer are sporadic. And by sporadic, I mean you have no cause, or you cannot identify why this person has gotten breast cancer. You can't identify. Then the rest of the 10% of the population, there are other multiple factors. So the biggest and the most known is female. Being a female alone is a risk of breast cancer. Being a female and increasing age. So the older you grow, the more at risk you get. The more at risk you are for getting breast cancer. The third is familial history. So it has a very high genetic predisposition. So for people who have relatives, and it's mainly on the maternal side, if you have maternal auntie, maternal grandmother, or your mother's sister, so it mainly goes to the maternal side. So if you have a first-degree relative who has a history of breast cancer, then you're at higher risk of having breast cancer. And this also goes with some genetics, and there's what we call a BRCA1 and BRCA2 gene. So most people who get breast cancer within the family, they express that gene within their DNA. So they are at risk. We usually check for it. So if you have first-degree relative, if you have a male relative in your family who had breast cancer, if you have a sister who had breast cancer, so any first-degree relative increases your risk. The other is if you have a first-degree relative who had other endocrine cancers, so ovarian, endometrial cancer, aside from breast cancer, you're also at risk of getting breast cancer. So that is the familial history. And then we have what we call the hormonal predisposition. So if you predispose to estrogen, there's a hormone we call estrogen. So estrogen is what helps us be women, what helps your breasts to grow, what makes you go into your menstruation, what helps you develop into a woman. So if you have higher exposure to estrogen, you're at risk also. So the higher exposure to estrogen is if you started your menstruation early, so those who start at 7, 8, and then if you delay to reach menopause. So that means if you start at 7 and then you get into menopause at 60, you have a longer duration of being exposed. And then those who have never given birth. So usually when you're pregnant, you have, in those 9 months, the estrogen levels are lower because the progesterone is now higher to sustain the pregnancy. So the more you deliver, the more time you reduce to be exposed to estrogen. So that helps. So people who have not given birth are at higher risk. So the working women, yes, the career women are at risk, unfortunately. Yes, then contraceptives, exposure to contraceptives because it has estrogen. Yes, the other one that is important is, so those ladies who have reached menopause, so those who are not going into their menstruation anymore. So estrogen helps in maintaining the bone density of a female body. So usually these ladies, when they reach menopause, they experience a lot of bone pain. They get pathologic fractures, back pain. So they give them hormone replacement therapy. So they're replacing the estrogen. So that increases the risk of getting breast cancer. So the other risk factors you have, if you had breast cancer in the other breast, you can still get in the contralateral breast. If you were exposed to radiation when you were young, for any other cancer you can still get. And then the other thing is obesity, smoking, yes, and lifestyle, yes.
Oh my goodness, it's a lot to take in, you know?
Yes,
it's really a lot. It's almost like you just cannot escape, just to praise God.
That's true.
What are some of the early symptoms that someone can recognize and run very fast? Harriet said she delayed.
So, unfortunately, most of the people who present with breast cancer, they have no symptoms. Sometimes it is a very small mass, 1 centimeter mass, and they have no pain, there is no change in the breast. It is really asymptomatic for most of the patients. Then there are those who will actually present with a mass. So those that present with a mass, it is usually not painful, like Harriet said. So you actually don't go to check on it because it is not painful. So there are those who will present with a mass, but it is not painful. Then there are those that will have a mass, and then it is painful, then they'll come and check. Yes. The other symptoms that people usually come in with is the breast there'll be changes in how the breast looks like. Either it will have some dimples, or they'll have some discharge from the nipple. Unfortunately, most of the patients we see, they present late. So those who come later on, when the cancer has already grown, that is when you see the real changes on the breast. So the change in color, the breast is swollen and inflamed. And there's what we call pudorrange. So that is when your breast skin looks like an orange peel. So usually that happens in very aggressive cancers and when the cancer has really overgrown. So those are local changes that happen to the breast. But then there are systemic changes that can also happen. But these happen after the breast cancer has metastasized to the rest of the body. So if it goes to the brain, you'll have changes in your neurology, so headache, altered mental state. If it goes to the lungs, you have difficulty in breathing. If it goes to the bone, you'll have back pain. So it depends on which stage it is. But like I said, most of the patients are asymptomatic. They have no pain, or they have a small mass. Yes, that is negligible.
Okay, I've heard that men can actually, I've read and heard that men have experienced breast cancer. Is that true?
Yes, so the percentage of males that get breast cancer is small.
Okay.
Unfortunately, breast cancer in males is very aggressive, very, very aggressive. They usually present in late stages, and it is hard to treat because, yes, anyway, I'll explain that later on. But there are specific types of breast cancer. So it is grouped into different types. And it is grouped depending on, like I talked about, estrogen. So there are certain receptors that your breast cancer will show. So there's estrogen receptors, there's progesterone receptors, And then there's what we call the HER2 receptors. So that is how they group the breast cancer. So there are people who will have breast cancer and it expresses the estrogen receptor gene. And then there are those who will have and it expresses the progesterone receptor gene, then the HER2 gene. So those who express those genes, they have a less aggressive form of cancer. Unfortunately, if you have cancer that doesn't have those genes, then it is more aggressive. And unfortunately for the African Americans, we usually get the one that has no estrogen receptors. And it usually presents in people that are less than 40 years of age. So those who get breast cancer above 40, they usually have the estrogen receptor. But if you get breast cancer below 40, most likely it doesn't have estrogen and progesterone, which we call the triple negative.
It's a little bit complex, really, but yeah, thank you for trying to explain to us,
yes,
us the laymen. But we're going to go for a commercial break. When we return, we shall be looking at self-examination. How can someone do it correctly at home? So let's run quickly for a commercial break. We shall be right back. Stay with us. Welcome back from the break, and thanks for staying with us. I am Viola Sasya. This is NTV Medical Matters. We are supported by Bill and Melinda Gates Foundation. And in studio today, during this Breast Cancer Awareness Month, we are with Dr. Victoria Nkore from UMC Victoria Hospital. She's a surgeon, and we're talking about breast cancer. Before we left, we were talking about self-examination. How can we do it? How often? And how effective is it?
So breast self-examination is a modality for trying to screen for breast cancer. So there are screening modalities for breast cancer. And breast self-exam is like the simplest and the one you can do yourself. So it is usually when you're in your bathroom. A lady, can I demonstrate?
I think you can.
Okay. So yeah, you need to demonstrate. So when you're in your bathroom, you're standing up. You put your hand below your head. That is just to emphasize the breast. Okay. And then you keep checking. You keep palpating the breasts, checking the breasts. You go in a circle and just keep, you massage the breast against the rib cage.
Okay.
Yes. So if there is any mass in between, because it will be in between, if there is any mass, if you're massaging it against the rib cage, you'll actually feel the mass. You will feel it when you're checking. So you check the whole circumference of the breast. Then there are those who have big breasts that are a bit pendulous. So there you touch your breast, you hold your breast like this, and then you keep checking. And you just follow in a clockwise manner, okay? So that is the self-breast exam. Usually when you feel a lump, you just go and to a hospital, at least for further evaluation. Okay. Yes.
How often should it be done?
I cannot really specify. So anytime.
Okay.
Yes, anytime. Because if you do it today and you don't feel it, you don't really need to do it every day.
Okay.
Yes, but once in a while you check your breast, and then to make it easier, you lather some soap, and then yeah, it makes it softer to ballot the breast. Yes, so that is the breast self-exam.
What other exams are there, especially for someone just passing by to check if they're sick?
So the breast self-exam is what you can do at home.
Okay.
The other screening modalities are done in the hospital. Yes, so for example, if you are doing a breast self-exam and then you come to the hospital, or you have pain in the breast, or you felt a lump, there are just changes in your breast. So you come, we have to first do a history, a clinical evaluation, which includes history. And in history, we are mainly looking at the risk factors. Like I told you, the risk factors that I mentioned.
Yeah.
So we are mainly looking at those risk factors in the history. And then other things of how your symptoms have been or how they've been progressing. And then we examine you. So I will examine your breasts and feel for any mass. So in case I feel for any mass, So after I feel for then any mass, I now send you for investigations, okay? So for the investigations, we have different modalities, but the ones for screening is an ultrasound scan and a mammogram, okay? So they can be used differently, but ultrasound is like the first line for screening. But it mainly applies for people below 40 years of age. Usually because they have more dense breasts. The breasts are still dense. Yes, so we do an ultrasound scan, which will show you if you have a mass, how big is it, how does it look like, because it can even show you if it is benign or suspicious for cancer. And then for those above 40, you send them for a mammogram. So a mammogram is like an X-ray of the breast. Okay. Yes, but it is more sensitive in less dense breasts. So those that have had many children, but above 40, yes. So
are there lifestyle changes that an individual can adopt in order to lower the risk of breast cancer?
Like I told you, most of the cases are sporadic. And then the other big risk factor is familial disposition. So they're not really, the modifiable risk factors are smoking and obesity. Okay. Yes, those are the major ones. The rest are really non-modifiable. You cannot change your mother or your maternal familial tree. So most of the cases are non-modifiable. The others are estrogen, the amount of time which you can also not predict, because you do not know when you're going to menopause. Yes, unfortunately.
So at what stage is breast cancer cured, and what are available treatment options right now in Uganda? Okay, so breast cancer, so whenever you have cancer, we stage it. So the staging depends on how much or the level of the disease that you have. So stage 1 is usually, it is in one place and less than 5 centimeters. And then stage 2 is greater than 5 centimeters. So it's still local disease. Okay,
yes,
so good morning. What's your name and your question?
This is Rebecca calling in from Kavaganda. Can someone be born with cancer?
Okay.
Hello?
Hello, thanks for your question.
Thank you for the question, but that is a very difficult question to answer.
Absolutely.
Yes, yes. So there are people who are actually born with cancers. There are children that have cancers, but those are childhood cancers. Okay. And that is a completely different topic, and they are managed in different ways.
Okay, so we continue with the treatment options available currently.
Yes. So for...
Hello?
Okay, so we have someone else. Yes, please.
Karen, keep quiet. Hello?
Your name and your question, please.
Yes, I would like to ask the doctor, can someone do a breast examination when they are breastfeeding?
Thank you.
Yes, you can do a breast exam when you're breastfeeding, because you can actually get breast cancer when you're breastfeeding. You can get breast cancer when you're pregnant. Actually, pregnancy can worsen it speeds up the level of the breast cancer. So yes, you can do a breast exam when you're breastfeeding.
Okay. We have someone else. I think they're gone.
Okay. Okay,
thanks for clarifying that. So available treatment.
So the available treatment depends on the stage. So local disease, stage 1 to stage 2.
Yes, please. Your name and your question. You can continue. You get interrupted.
So stage 1 and stage 2, like remember the receptors I told you about. So when we see the mass on ultrasound and mammography, we do what we call a biopsy, like Harriet was saying. So we shall take off samples, go into the mass and take off samples, and then check them, see which cancer it is. So when we see which cancer it is, we also see which genetic makeup is. Is it estrogen receptor positive? Is it progesterone receptor positive? So those help us in prognosis and in treatment.
Okay.
So the stage, the receptor status, yes, mainly that. And then the general patient, how they are.
Yes, please, your name and your question.
The passport. I'm a male. I was asking
Yes, please.
that I have those of adolescent stage,
Okay.
they failed to go. And I'm now 28 years, so I don't know how you advise me.
Okay, so male gynecomastia sometimes doesn't go, but usually it's supposed to go after the teenage years. But it is really not dangerous. It is just the cosmetic effect for the males, but gynecomastia in males is not really dangerous. It really has no issue. And unfortunately, if you've reached 28 and it's still there, it may not go away. The treatment would be surgery to remove the extra fatty tissue that you got during your teenage years. But it really doesn't increase the risk of breast cancer. Yes.
All right. Yeah, so we were talking about treatment.
Yes, so stage 1 and stage 2, you get the surgery.
Yeah.
So
from Bale.
Okay, what's your question?
So how can you identify breast cancer?
that is a wide question. I have just been explaining. When you feel a lump or a mass in your breast, you go to the nearby health facility, and then you see a doctor, they examine you, and then they send you for tests to help rule it out or confirm the diagnosis. Yes. Anyway, so like we were talking about the treatments. So for all cancer, we need to take it away. Any cancer, as long as it is cancer, we need to take it away. So if you have breast cancer, even if it is a 1 centimeter mass, you have to undergo surgery.
Okay.
But the times of the surgery are the ones that differ. So for Harriet, she first underwent chemo, but that was to try and downsize the cancer.
Oh, yeah.
Before she can have the surgery. But everyone is supposed to have the surgery. Unfortunately, for those who are in stage 4, the surgery does not take away the cancer. Because it is already stage 4.
Okay.
So stage 1 and stage 2, there are modalities of removing what we call lumpectomy. So you just remove the lump and some extra margins, wider margins, and then you reconstruct the breast.
Okay. Yes, please. What's your name and your question?
I'm asking.
Yes, please.
Somebody has a breast pain.
Okay.
Breast pain. If you continue to breastfeeding the child.
Okay. So if you have breast pain, you need to know what is causing the breast pain. In a lactating mother, there's usually what we call mastitis, and that is because of infection in the breast. So if there's breast pain, you need to go to the hospital and they find out what it is that is causing the breast pain. Yes, we first hold on the breastfeeding and go to hospital so that she can get treatment and then continue the breastfeeding.
Okay. All right, so from your experience, what are some of the biggest challenges the patients go through, and what should they know ahead of time, especially if they're going to embark on the journey, especially once they find out, I am sick?
So, first of all, giving bad news is the most traumatizing thing to a doctor. That is, giving bad news is the most traumatizing. So counseling for the patient is the most important. First of all, they need to know what they're dealing with. So there are instances where the relatives will say, don't tell her she has cancer, don't tell him he has cancer. So that is not a good thing. The patient themselves have to know what they are dealing with. Yes, it is hard, but they need to know the truth. So when they know what they're dealing with, so they know what cancer they have, which stage they are at. So if they're at stage 1 or stage 2, you know there's hope. If there's stage 3, there's possibility of going to stage 4, and then there's possibility of regressing. But if it's a stage 4, the patient needs to know so that they know we are not going to do any miracles, unfortunately.
Okay, we have someone. Yes, please, what's your name and what's your question?
I'm called Sharon.
Okay.
Yeah, are there other diseases affecting the breast apart from breast cancer?
Thank you, Sharon.
I didn't.
She wants to understand whether there are other diseases that affect the breast apart from breast cancer.
Oh, yes. So breast cancer, actually, there are very many different diseases of the breast. And breast cancer accounts for about 2 to 5%. The rest of the 95% is not cancer. So there are very many masses that you can get in the breast, but are not cancer. They can be infectious, but most of them are benign masses. Yes. So cancer accounts for about 2 to 5%. Yes.
You said we couldn't work a miracle, especially at stage 4, but have you seen a success story where breast cancer has been cured completely and the patient sent home?
Unfortunately, in my small years of practice, I have not seen that.
Okay.
But I think I have colleagues who have actually treated the patients and they got cured. But the ones I've seen, unfortunately, and mainly from our fellow colleagues, usually get triple negative breast cancer, which is common in those below 40 years of age, and those rarely survive. Yes, so below 40 years of age, those are the ones I have seen most. The ones who are above 40, those ones at least you treat the patient for more than 10 years at least, yes. But the ones I have not seen a success story, unfortunately, for cure, yes.
This is the Breast Cancer Awareness Month, and we are having this conversation. What can you say to the women watching right now, especially those who fear to go to the hospital or ignore symptoms or take painkillers, just like Harry? She took painkillers for 2 years before going for treatment, as well as the men. Men are actually really participating. It's very wonderful to hear. So what message do you have for us?
So the message I have is breast cancer is real and it is within our community. Unfortunately, it is a leading cause of death in African communities, but mainly because we present late. And like I said, most of the cases are asymptomatic. So it is good to go to the hospital and actually check. For those who have a relative who had breast cancer, I would advise them to check even before they are 40 years of age. For those who don't have any relative with breast cancer, those ones can check after 40. So when you go to the hospital, if you're above 40, you go and do a screening ultrasound scan or a mammogram. If it is clear, then you wait for 2 years to go back. And then for those below 40, if you have a mass, it is better you come and check it.
Okay.
Okay? But if there is just breast cancer awareness in any hospital, utilize the opportunity. You never know. Like I said, most cases are symptomatic. Okay. So if there's any cancer awareness, please utilize the opportunity.
We are going to be talking about where they can go, or where our viewers can go to find such services. But first, we have a video that we would like to play again. Take a look. Journey over 5 years and now beyond. So how has your life changed if you compare to how you used to be back then, 5 years prior, and how you are now? That's in terms of activity. What are you able to do? What aren't you able to do? And what else do you realize has changed so much about your life?
My life really changed because compared to the way back when before I discovered that I had cancer, after my treatment and everything, my life really changed to the extent that there are some things I'm not supposed to do. I'm not supposed to do heavy chores like washing, carrying things. If I can do this with this hand, but I can't do this because of the pain. And if I over insist on doing the heavy things, I get pain because it's my left where the heart is. I get really too much pain, and when the pain comes, I get swollen like this. It swells. And you know, as a woman, you feel like every time I look at myself in the mirror, I'm like, something is missing. I get traumatized, and there is a way society judges me, those who don't understand, because I was this kind of a girl who used not to put on bras, move freely, but now I can't move without a bra because I have to put an artificial breast in there so that I can move out. Maybe if I'm around people that know me, I can move it freely, but it really, my life really changed a lot. I can't work, do heavy things. Back where I used to plait hair, like I can plait like 2 to 3 people, but of recent, I can only plait one, because even like due to being bedridden, I got side effects in my legs. I can't stand for long. I get pain, a lot of pain. And you know, when you're plaiting hair, you have to stand. You have to stand for so long. And it has really affected me so much in my working area. So life really, really, really changed a lot after the cancer and up to now. Because they tell me if you overstrain the hand, there is a way you trigger I'm told about the veins. Inengeri damu n'ogukosa. Because when nkole nnyo wano wazimba. Obulamu bukyukira ddala. Tosigala kye kimu. You become weak. My skin, there is a way my body changed into. Nswera ne oba ensiri bw'ennuma wayitawo eddakiika nga wazimba. I started stammering because of the side effect of the medicine. I stammer once in a while, and when it comes, kijanga chamaani. At first I was like, what's not happening? Then when I went for my review, nembuuza doctor, nangamba it's the side effect kubanga eddagala likulwamu, it takes long in the body. So those side effects zijanga, like I said in the first place, buli omu aina side effects zakolaki zafuna. Kati those changes come nga totegedde kitegeera. So I'll take you back wali nti singa batusomesa ekimala nomanya nti I'm starting the chemo. This is what to expect. At the end of the chemo, this is what you're going to expect. At least kigenda okujja nga you're ready for it. Nga you're ready for it. If this comes, meaning ngenda kolachi, I'll be ready for it. Nze nyinza okubeera nga yandetera okusitamaringa. I don't know what other. Yes. My question is, doctor, I don't get my periods ever since I started taking tamoxifen. It is 5 years now. What causes that, and can I conceive after the treatment? Is it safe for me to conceive again?
Yeah, that is Harriet going back through her story. It's really, yeah, it's sad, but she's fighting on strong. So her question you had, maybe you could just go to that directly.
That one I am not very sure about the conceiving. The reason why she is not going into her period is because, like you said, remember when I talked about the estrogen receptors. So tamoxifen mainly targets the estrogen receptors in your body. So it is killing them off. Yes. So you like going into a premenopausal state. Yes. So that is why she's not able to go into her periods. I am not sure about the giving birth. I don't want to. I'm not very sure about that. Yes, but I'm not sure if it is safe to have a baby after. Yes.
So thank you for answering her question. I'm sure she's watching. She had promised to.
Yes.
So let's talk about where Ugandans can go for consultation services and screening.
Okay, so Ugandans can go to any big, I would advise them to go to a good hospital, a big hospital. That is where you know you will find a doctor who will examine you very well and decide on the next treatment. So any facility that once it says it is a hospital, at least you'll find something to start. Not a clinic, a hospital. Okay, yes, so like my hospital, UMC Victoria Hospital, Mengo Hospital, Kampala, all the different hospitals, at least you're sure there is a specialist there, a surgeon there who will treat you and examine you.
So what are you doing special for this Breast Cancer Awareness Month at UMC?
So at UMC, I think the team is organizing breast cancer. They're subsidizing on the breast cancer awareness, so the scans, and then I think free consultation for breast cancer, I think, yes. So that is mainly to improve on the breast cancer awareness for this month. Okay. Yes, and then some teachings here and there for different companies, yes, to try and sensitize the masses about breast cancer.
Well done. So Victoria, I'll give you about 2 minutes to say your final words to our dear viewers who've watched and actually participated so much today, and then I will let you go.
So what I want to emphasize as I finish is what Harriet talked about, how cancer affects you after the diagnosis and the treatment, the surgery, the chemotherapy. Unfortunately, we do not have very good counseling services or psychological management, but psychological treatment is part of cancer treatment. Unfortunately, you cannot deal with everyone's personal problems the way they should be. And that is mainly because Cancer Institute gets a large volume of patients. So they can also do so much. They can only do so much. But yes, there are side effects to chemotherapy. And yes, there are side effects to the surgery. So everyone who has the surgery and the chemotherapy will not remain the same for life. And the other thing is, but they have to be strong, unfortunately. So there's a saying is in medicine that risk outweighs, the benefit outweighs the risk. So the benefit of chemotherapy and surgery outweighs the risk of the side effects to these. So we need to do away with the cancer. My final remarks is herbal medicine does not treat cancer. Unfortunately, because it is a very big psychological shock to most of the patients, they tend to get like a blackout. So they try and listen to they look for every solution. They go to the pastors, they go to the herbalists, but at the end of the day, the cancer is growing the more time you spend. There are those who will come to you and then go to Kampala Hospital, then go to Mengo. So once you remain in one place and treat. Thank you very much.
Thank you so much, Dr. Victoria Nkoe from UMC Victoria Hospital. And thank you so much, dear viewer. It's really been a pleasure having you today. We've come to the end of NTV Medical Matters. We are supported by Bill and Melinda Gates Foundation. Until next time, have a lovely day.